Back. Exactly this time dives us into a focus point, and today we are majoring our focus on stroke oba okusanyalala. Nja kugulawo amasimu maaso awo otukubireko obuuze ekibuuzo ky'oyagala okubuuza oba ky'owandyagadde okutegeera oba ky'obadde tomanyi. Leero dokita ali mu nnyumba, tugenda kuba twogera ku kiki ky'otamanyi ku bulwadde bw'okusanyalala. Obulwadde bw'okusanyalala obumanyi? Kiki ekibuleeta? Ani gwe bukwata? Ani gwe butakwata? Ani ali mu buzibu bw'obulwadde buno? Era tukoze tutya okubwewala? Twogera ku stroke. Now, Dr. Asasira Ignatius, he's going to be joining us, and we're going to be splitting this into possible tiny pieces, and by the time we wind up the program you would have understood what you didn't know about stroke. Now, Dr. Ignatius Asasira comes from Alliance for Stroke Awareness Prevention Project. He's going to be diving into it. But remember, the World Health Organization report, which states that annually 15 people worldwide suffer from stroke. 15 million people annually suffer from stroke. 5 million of these die, and 5 million of these are left permanently disabled, hence putting pressure on families and communities. Now, that's how bad stroke is. But now the big question, who is at risk? What are the causes? How can we prevent it? Is it possible? So when we get to know this, I hope everyone there will be ready to prevent and will be out of danger. We are creating awareness. Bethany TV for Health is about creating health awareness that you may know. Someone says that knowledge is power. What you don't know will kill you. What you know cannot kill you. Very, very significant to know. What you know will not kill you. What you don't know will definitely kill you. So that's why we are splitting, we are delivering knowledge to you that you may not know. In this generation, you can't afford not to know. The question will be, why don't you know? So you have to do whatever it takes to know. You have to do whatever it takes to knowledge. Chintumte Sasira Senior is my name, and we're going to be diving into it. Just get your pen, just get your paper, just get ready to dive into this interactive morning show where we get to discuss more about stroke. Like I said, wakatwegatako tugenda kuba twogera ku bulwadde obw'okusanyalala. Okusanyalala kiki? Okusanyalala kiki ekikuleeta? Olabyeko oyinza okubanga oyina muzaddewo, oba oyina mugandawo, oba oyina kojjaawo, oba jjajjaawo, oba kitaawo, oba omuntu oyo yenna gw'oyina akuli okumpi oba oyo bw'ofaako nga yakwatibwa obulwadde buno obw'okusanyalala. Leero bwe tugenda okwogerako, era tusobola bwewala tutya, era twogere n'okuwulira kiki ekibuleeta, kubanga bw'omanya ekibuleeta osobola okubwewala. Buli lw'otamanya kireeta kizibu tosobola kukyewala. Jjukira nti essira tulisiza ku prevention, okutangira, okuziyiza kusinga okuwonya bwe bagamba. So awo we tutambulira osobola okwewala kino, because omuntu omu yagamba, olwo enjogera egamba nti ebyafaayo biddiŋŋana, naye waliwo omuntu omu yagamba nti bantu banafu be baddamu ebyafaayo, kubanga oba otegedde ekireeta ate lwaki ekintu ekyo kiddamu ne kikukosa, kitegeeza tewategeera, era kitegeeza tomanyi, ate obutamanya bulwadde. Nga nditeeka bwe ligamba nti obutamanya tebukugisaako musango. Katosobola kubeera mu mulembe guno nga tomanyi, kubanga bajja kubuuza lwaki tomanyi, nga waliwo ebikozesebwa byonna, waliwo Bethany TV, waliwo information yonna noba nga tomanyi. Leero gwe yakatwegattako tugenda kwogera ku bulwadde bw'okusanyalala. Omusawo agenda kuba abuyuzaayuza akubuulire ki ekibuleeta, naye nga jjukira nti tugezaako okukumanyisa, tugezaako okutangira, kubanga ekibiina kino Dr. Kyavaamu kyekikola, ate naffe Bethany TV kyetukola olunaku lwa leero, creating more awareness on stroke. So the topic is what you didn't know about stroke. That's where we are going to dwell. I'm joined by Dr. Asasira Ignatius, who comes from Alliance for Stroke Awareness Prevention Project. Like I said, the World Health Organization report states that Annually, 15 million people worldwide suffer from stroke, but also 5 die, but also 5 million people. 5 million die and 5 million people are left permanently damaged. And this exerts a lot of pressure on families and community. So that's where we are going to come from. Doctors in the house, Dr. Asasida, very, very, very welcome.
Thank you very much for hosting me.
Yeah, this is a very, very interesting topic because it is affecting everyone. Imagine 15 million people worldwide suffer from stroke. That is too big. But now, before we go there, Alliance for Stroke Awareness Prevention Project. What is it more about that?
Okay, thank you very much. And for our dear viewers, good morning. Alliance for Stroke Awareness Prevention Project, named as ASAP, is a charitable organization that was started about 10 years ago by a neurologist from Johns Hopkins Hospital in the US. So he came to visit as a visiting professor at Mulago Hospital, and he realized that there are so many stroke patients, of which many of them did not know that they had high blood pressure before the diagnosis of stroke was made. So out of his love, he really said, let me start up an organization where we can do free cardiovascular risk assessment, free blood pressure screening, and diabetes screening. And we've done this for the last 10 years.
Fantastic.
In Uganda, there are 9 project centers, and we target high volume facilities, that is markets and churches. So churches are more organized. So every Sunday, we are at Namirembe, we are at St. Augustine Makere, we are at Uganda Matters Namgongo, we are at Nsambia, the Catholic Church in Zambia.
St. Peter's,
Zambia. On Fridays, we are at Old Kampala Mosque, and other 9 facilities. We are yet to restart at All Saints Namirembe and Rushoroza in Kabale. Yeah, so if you see, for example, the last 8 months, we've screened about 12,000 people.
Wow.
And out of the 12,000, we found that 2,000 of them, it was their first time to screen, averagely 2,000. Out of these 12,000, we've also realized that over 25% of them are hypertensive. They have high blood pressure, and we've routinely followed them up over time and found that they're actually hypertensive. So we offer mainly 4 services. The first one is screening, what you call measurement of high blood pressure to masses for free. Secondly, we do education about cardiovascular risk assessment. Thirdly, we counsel those whom we find are sick. We do not offer medication. We counsel and link them to care because we have partners. For example, Mulago Hospital, which is the national referral hospital. And then lastly, every 2 times in a year, we do diabetes screening. Like we're going to see in the causes, diabetes and high blood pressure are like brothers and sisters. When one is there, when I'm hypertensive, hypertension... Twins, it triggers my body to tend to allow diabetes to also get into the picture.
Wow.
Yes.
Yes, doctor, thank you so much.
So I've been working with this ASAP for the last 5 years as a volunteer. We have volunteers who are medical students, medical doctors, to stay and give back to society as a corporate social responsibility.
I'm also looking forward to Bethany TV teaming with ASAP.
It would be our pleasure because actually our plan is to start up a mobile hypertensive clinic, for example, like at City Square.
Yes.
These large volume areas. And also go up country and partner with organizations, churches, AGM meetings, and how people realize how their brains are working. Our mission is saving brains, saving lives.
Fantastic.
Yes.
For those who've just joined us, you are on Focus Point on Health Morning. Chintumde Asased Senior is my name, of course, joined by Dr. Asased Ignatius, who works with Alliance for Stroke Awareness Prevention Project, and we're discussing what you didn't know about stroke. Now, like I said, that 15 million people worldwide suffer from stroke. Annually, 5 million of them die, and 5 million of them are left permanently disabled. And this exerts a lot of pressure on families and community. But now the question is, what is stroke? Dr. Ignatius.
So stroke is a medical condition that, in simple terms, I'm not going to use the complicated medical jargons, but look at the brain as a tissue that is continuously receiving blood. So the moment there is anything that reduces the amount of blood reaching the brain, or even completely cuts off blood supply to the brain, then the brain cells start undergoing death. Actual research shows that if you completely cut off blood flow to the brain, you will need about 4 to 8 minutes before you have complete brain death.
Wow.
So a stroke comes in, we mainly have 2 categories or 2 types, ischemic and hemorrhagic. Ischemic is when there is any obstruction or obliteration to the flow, then that area that has not received blood starts complaining that I'm not getting oxygen, I'm not getting nutrients, so it kind of dies off.
Okay.
But then you also have hemorrhagic stroke, which happens when there is bleeding within the brain. You've heard about people who bleed in the brain.
Yes, they had an accident.
Maybe they had an accident or a fall. So it can either be an intracranial hemorrhage, or it can even be a subarachnoid hemorrhage. It's not the entire brain tissue that's bleeding, but there's something called an arachnoid space. So within that space, there can also be bleeders, because there are blood vessels within. Okay. So a stroke comes in when you have this obliteration, and one of the commonest symptoms is someone is going to get paralysis.
Yes.
Which can either be left-sided alone. So when I say left-sided, it means from up all through half of the body is going to be paralyzed.
It dissects the body bilaterally.
Bilaterally.
Okay.
So it can either be left-sided or right-sided, or sometimes bilateral. You find both sides have been affected.
Doctor, allow me to reverse a little bit.
Yes.
Why is it called stroke? Is it like a cane or a stroke of a cane? Or
it is called stroke because of the way how it manifests. This is something that is going to acutely affect you. You know, you've been, let's say, hypertensive and you've not been taking your medication and you've never screened. Then just one sudden morning, all of a sudden it strokes you. It canes you, and you find that you can no longer hold a cup of coffee.
Yes.
You can no longer speak. Actually, one of the things we, maybe just to help you understand the word stroke, when we're at home, we advise people to use the acronym FAST. F-A-S-T. For you to understand if your patient or your mother or your father could be actually suffering a stroke. And the F stands for face drooping. So you tell the patient to smile, just like I'm smiling, you know. If you find one part of the face is drooping, drooping means like it's falling. Because when I smile, the muscles should be like almost on the same level. But if you find one side of the face is drooping, it's a sign that you could be suffering a stroke.
I've seen people talking as if it's the mouth is going.
Very good. And now that's the S, you shall talk about it. Then the A is ask the patient to speak. Say something, you know. No, A is for arm raising, S is for speaking. So arm raising, you tell the patient to raise the hands above the head. Ideally, when I raise my hands, they should stay in position.
Yes.
If my brain control system is well. But because of a stroke, you'll find the affected side, the patient's hand would easily droop, to easily fall, you know. Then the S is speech. So ask the patient, say something simple. For example, I'm called Ignatius. You'll find they cannot, their speech has started getting difficulty. You know, they cannot complete statements without stammering or without getting difficulty. And when you see those 3 signs, the T is time to call an emergency.
We are talking about symptoms.
We are talking about symptoms
Now, can I apply that acronym at home, or can anyone do that, use that as a litmus
paper tool?
Ascertain whether someone
we used to study in medicine, thank you for the question, that diseases do not read textbooks.
Wow.
So we may have all these flow of symptoms, but it's not a guarantee that every patient will manifest the same way. So what are some of the common symptoms which you need to look out for? One are convulsions. Some of these patients are going to have seizures. The Baganda call it okwesika. You you know.
In children, a Yahweh.
Yahweh. Then secondly, they can get incontinence, bladder and urinary incontinence. You find they can no longer control their sphincters. So urine is just flowing or feces are just flowing because now the brain can no longer control the sphincters. 3, and very important, altered mentation or even reduced level of consciousness. You find someone is no longer conscious. You're calling Ignatius, Ignatius is not responding or he is very slow to respond. There's something called the GCS we use in medicine. The other important symptoms you also need to look out for are what you call the focal neurological deficits. So there are those
focal neurological
deficits.
Yes,
there are those things in the outside the brain which manifest when the brain has been injured. For example, body weakness. You find, like we already said, one half of the body is very weak, cannot hold a glass, cannot write, cannot speak, you know. Even walking, you find from me to walk from here up the other door, I can no longer have the normal walking pattern. I'm staggering, I'm having a waddling gait. There are different terminologies which you use in medicine. So if you see any of these symptoms, because it's a brain disease, it's not going to manifest only in the brain, but also the rest of the body.
I was going to ask, doctor, why does it strikes bilaterally? Is it because of the left brain, the right brain? Because are there incidents that someone is struck the whole body, or it has to be side by side?
So for most of the cases, unilateral strokes are more common than bilateral. But when you go into what you call the pathogenesis or the pathophysiology, the science behind why you're actually getting these convulsions and these hemiplegia, we come back to the blood supply of the brain.
Yes.
So I want you to know that generally the brain is kind of divided into 2. We have the left cerebral hemisphere and the right cerebral hemisphere.
Okay.
So the right side of the brain controls the left side of the body.
Amazing. Why does it crisscross?
Yes, that's medicine for you. And the left side of the brain controls the right side of the body.
I'm sorry, I'm taking you up. I'm getting so heated up and interested. That there are people, Simanya, I hear there are people who use the right side of the brain and others use the left side.
Yeah, it's called cerebral dominance. Which part of the brain during development developed faster and end up becoming more dominant, which can partly explain, although not fully, why some of us are right-handed, others are. Their dominant hand is the left or even the left hand. So when the stroke is coming up, the blood supply is, the blood vessels that are supplying this brain, it will depend on which blood vessel has been affected most. If you cut off blood supply of the right cerebral artery, then that part of the brain is going to be underperfused. It's going to go ischemic. Or if it is, let's say, an accident and the fall was on this side and the bleeding is happening within the subarachnoid space on my right, then the hemorrhage is going to be on the right. So the side of the brain that's going to be affected is contralateral, not ipsilateral. So I will definitely end up getting a left-sided stroke. So by the time you get a bilateral stroke, it means both sides of the brain have been affected. Wow. Yes. Wow. That's in simple English. We can go deeper, but it's not necessary for us to go so scientific. So the most important thing to take home is really that a stroke, in most cases, will affect one side. But like I said, diseases do not read textbook. It can also affect both sides, especially in old age. You know, we didn't talk about the risk factors, but old age is a very important one.
We were coming there.
Okay.
I think we should go on the risk factors. Who is at risk?
Okay.
Yes, sir.
So who is at risk of getting stroke? Members who are listening, stroke is a non-communicable disease. It's the second leading cause of death worldwide. And here in Uganda, a study showed that over 30% of the admissions in the hospitals, our hospitals, are because of cardiovascular related conditions, and stroke is one of the most common ones. So many of us are at risk, but we don't know. That's what I'm trying to bring out.
Yes.
The first common risk factor is age. Old age is associated with a higher risk of
Doctor, what do you
stroke.
mean by old age?
And age above 60 years, because in our setting, low and middle income countries, 60 is really on the upper end. Sicklers, people who have sickle cell disease at a very high risk of getting stroke as one of the crises. Then those who use tobacco and smokers, you are at a very high risk, especially for the subarachnoid hemorrhage. Partly because, okay, tobacco and alcohol use, they go hand in hand. You know, when you use alcohol, there is a high chance there are some side effects like falls, trauma, accidents. So that can also partly explain why they're at a high risk. Because, sorry, when you check like here in Kampala over the weekend, there are so many road traffic accidents happening because people are drinking under the influence of alcohol.
In just 9 days, we had 449 accidents in Uganda.
449.
Just 9 days.
In 9 days.
This month.
So you can imagine every time someone is falling, the brain is hitting itself on that tarmac. And the brain is, remember, the brain is suspended in a fluid in the skull. It's not like it's packed. No, it's actually floating. There is some fluid around that
it is like a space.
It's like a space. So every time you hit your head on the surface, this brain also goes and hits itself on the skull, in the inner part of the skull, and bounces back and hits this side. So you find you're at a very high risk of bleeding from both sides. So talking about that, also people who...
Doctor, sorry to cut you short. Going back to tobacco. Okay, tobacco is one of those huge causes, I mean, those high risks. But there are people who smoke weed and they say weed is medicinal. So for them, they are not at risk.
No, weed is not medicinal. At least to the best of, in relation to stroke. It may be medicinal for other conditions, but at least for stroke, we are saying that using tobacco puts you at a very high risk of an intracranial hemorrhage.
Okay.
The last 3 risk factors I want to emphasize. One is if you're hypertensive and you're not on your medication. Or you're on your medication and they get done and they say, but I feel okay, let me stop, please. That is very dangerous.
What's being hypertensive?
Last week we discussed hypertension, high blood pressure.
Yes, that one.
If you're a high blood pressure patient, please stay on your medication. If you are someone who is having a diabetes and dyslipidemias, diabetics, and you're not on your medication as well, you're at a very high risk of getting this condition. And then lastly, unfortunately, being a female puts you at a higher risk. Studies show that females are at a higher risk of stroke compared to males.
What causes that? Is it because, but actually I thought men are higher risk because, I thought because women have their monthly, so it actually alleviates so many challenges.
No. We are still having a lot of research behind that, but we are shocked by the results that 43% of the women, rather of the men, and over 57% of the women of all the cases we've had in the hospitals.
Oh,
yes.
Doctor, we are talking about stroke, but I heard you mentioning hypertension. I heard you mentioning cardiovascular diseases.
Yes.
What's the relationship between cardiovascular disease, and that is the heart, and stroke?
Okay, thank you very much. So cardiovascular diseases are diseases that affect the heart and the blood vessels. Okay. Cardiovascular. And one of these diseases is hypertension. Very common. High blood pressure. So what happens is that when you have an increased pressure, systematic pressure within the rest of your vascular system, this pressure also goes high for the blood vessels in the brain. And remember, we have said that the blood vessel, look at a blood vessel like a river carrying water towards a lake. So in this case, our brain is the lake. And there is a certain flow, pace at which this water should flow. And now for us, because of the poor lifestyle, we're eating a lot of junk, we are not working out, we are having poor weight control measures, blood pressure, we sit a lot. Last week we discussed all these things. Blood pressure goes skyrocketing. Even this river, the flow of blood in this river, in this case water, going to this lake is going to be higher. Now the brain has been used to receiving blood at this pace. Now you're bringing blood at this pace. It's going to definitely cause brain damage.
Wow.
You understand what I'm saying?
Yes.
So hypertension is a very common risk factor, especially undiagnosed and treated or long-standing hypertension. A very high risk factor for stroke. Secondly, sickle cell, still under cardiovascular diseases.
Yes.
Sicklers, I hope you all had heard about the sickle cell disease. So one of the common crises, what you call crisis within sicklers,
Yes.
is a stroke crisis. Because the body is having blood cells that cannot carry enough oxygen and hemoglobin. And we've said the brain, for it must constantly feed. Even when you're sleeping, there is blood flow happening in the brain. It never stops.
Wow.
That's why if you get hungry, the first thing that happens is fainting. Because the moment you have little glucose in blood, the brain is going to be the first part to demand, because for it takes in a lot. It's going to demand, and if you don't supply, it will say, okay, let me sleep. You know?
Yep.
Yeah. So cardiovascular diseases, high blood pressure, diabetes, very important. Diabetics are also at a very high risk of stroke, and that's why we encourage all diabetics. The moment you've been diagnosed, please be on medication and let it be religious with your medication.
Who takes you off medication?
It's still the doctors. So how we take off medication, like what we explained last week in high blood pressure. You don't come today and we measure and they say, oh, now you're okay, you can stop. No. We go on tapering the dose. If you've been on 200 milligrams of a certain medication, and for the next 4 months we are constantly monitoring you, and your glucose control, your glycemic control is good, we shall taper the dose from 200 to 100. Or if you've been on 2 medications, we shall remove 1 and leave you on 1. And like that. So we monitor you up to a point where we say, okay, I think your body now can control. And then we can try to put you off medication for some time as we monitor. If your body can handle, then we can put you off. But these are chronic conditions. That's something that must come out very, very well. It does not happen in one morning that you get a stroke. No. It usually, there are events happening downstream that all of a sudden, by the time you get a stroke, you actually have been you've been struggling for a long time. Your brain, your heart, your blood vessels have been struggling for a long time out of your consent.
Doctor, can children suffer from stroke?
Yes, they can.
Children?
If you interact with a pediatric neurologist in Mulago, for example, they will tell you that there are so many strokes within children.
Wow.
For example, children who are having underlying congenital heart diseases, those are conditions that they are inborn errors within the heart muscle. Either there is a hole in the heart, so it's not allowing blood to leave the heart when it is having enough oxygen. And the moment you have little oxygen leaving, blood with little oxygen leaving the heart, that means all body organs are not going to receive enough.
Yes.
And the brain is going to be the first one to demand. I've already talked about sickle cell. Sicklers, over 80% of them are children. You know? Because it's something that is the problem, the mutation that happened within the, I don't want to go into the science, but what happens for you to become a sickler starts as early as even before you're born. Because it's something you get from your parents.
Yes.
Either your parents are sicklers or they are carriers and you end up getting it. So you'll find its manifestation is usually in the first 10 years of life. That's when it manifests a lot. By the time you're 20, 30, 40 and you're a sickler, that means your body has, either you're on medication and you're taking it religiously, or your body has learned to accommodate this disease. But most of the crises happen during childhood. So children can also get a stroke.
According to the World Health Organization report, undeveloped countries are at high risk. What could be the cause?
So I would love to use the word poverty. Poverty is a risk factor for so many diseases.
Poverty is also a cause of many
Poverty
diseases.
is a cause of so many diseases. Its science is not explained by how we see the other causes and the other risk factors, where there are neuronal pathways and clear pathophysiological pathways. it comes back to the social constraints. If someone is having a poor socioeconomic status, one, they cannot afford even the foods we are talking about. Mm-hmm. Secondly, even when you get this stroke, managing the stroke requires someone who is really doing well. Because remember, it's going to cause almost permanent disability. You can no longer go to work. The costs of doing this EEG, doing these blood tests, routinely monitoring you, are very high. And we are not talking about the physiotherapy that comes along when you're managing this patient. Mm. You need to hire a nurse to stay at home.
That is a cost.
And it comes at a cost. Mm. Because if your father cannot control his urine and stool patterns, that means every other time stool is all over the place. You don't want to have visitors in your house, and
you need a caretaker.
You need a caretaker.
Who needs money?
Who needs money?
Wow.
You need to buy medicines every other time. So poor or low socioeconomic status is also associated with poor diet, because we've seen that this is a lifestyle disease, and diet plays a very fundamental role. If you don't have money, you can't buy the things we are talking about. We are saying be on fruits and vegetables, go to the gym and enroll to the gym class and routinely do your workouts, you know. We are saying have enough rest. You can't have good rest when you're having debts.
Yes, sure. You can.
Stress levels are going to skyrocket, you know. The moment stress levels skyrocket, cortisol is going to enter blood. Before you know it, your blood pressure is going to be skyrocketing. And to make matters worse, what you call screening. People who are in rural areas do not have access to these screening services as easily as those who are in urban settings. Because you'll go to a village and you find over like 80% of them have never measured their blood pressure in the last 10 years, and they're okay. But they're not okay because they don't know what is happening to their bodies. You know, last week we said that high blood pressure usually has no signs and symptoms. And the only way to know that you are hypertensive is to get measured. And most of these non-communicable diseases are asymptomatic. They are silent killers. So until you measure, will you not know that you are actually diabetic, that you are actually hypertensive, that you are actually a heart disease patient. You may be having these symptoms coming and you think, you know, I'm doing a lot of work, I'm easily getting tired, I'm feeling my heart is racing, palpitations, but when you're actually having an underlying heart disease.
How often are we supposed to screen?
So, if you see the pattern which we use in ASAP, every week we go out to screen these people. On an assumption that when you go on a church or in a market, we are not meeting the same people on a weekly basis. So for high blood pressure, if you're normotensive, we say at least after every 3 months, go and screen. So at least 4 times in a year. If you're pre-hypertensive or hypertension itself, we say measure more closely, at least after every 3 weeks. Go and see your blood pressure measurements. Diabetes, we do it after every 6 months. Okay, because sometimes because of the resources, because it's a bit invasive, you have to get a blood sample. Okay, not invasive as such, but you need to, it's not like blood pressure where you just put a machine and sit or listen. This, I have to get your blood sample, and maybe the resources may not allow us to do it more routinely. But for diabetes, you say at least after every 4 to 5 months, you need to measure your glucose levels.
How do we help this mind that thinks that when I go for screening, I'm actually worsening the situation? Some people are like, before I went to be screened, I was very okay. But the moment they diagnose and they found the thing there, things worsen. Is it a myth or it has some knowledge?
It is a myth, and the fact is, better the devil you know than the angel you don't know. Those are the authors of English.
Yes.
It's better you screen and you find out that you are actually having a disease, and then we start discussing the math on how to help you, rather than staying there in your comfort zone without knowing, without screening. You know, ignorance is a disease. You don't know that you're sick, and when you get a sudden cardiac arrest, sudden death, you know, someone sleeps and in their sleep they pass on, everyone in the village says, we know it's because of the other woman she got married to, you know, those people have juju at their home. No, we're not discussing juju here.
Theories.
Concocted theories. We are saying, please come and measure. The reason why people get frustrated, for lack of a better word, after screening and getting to know how they are standing, it's like how I came and I told you that you have cancer.
Of course.
Emotionally,
the burden of dealing with that information.
Just the burden of taking it in and you accept. Last week I was at this, just yesterday but one, on Sunday I was at St. Francis Zambia Hospital doing this blood pressure screening, and a lady came to me and said, honestly, I know I'm hypertensive, but I always feel like I'm okay. So me, I've derived a pattern. She's on 2 groups of medicines. She's on aspirin, cardiac ASA, and also another hypertensive drug. Yes, so she takes aspirin religiously, but then for this second drug, takes after every 3 days. So I take Monday, Thursday, and Sunday. And ask her why. She says, I have not yet come to terms to believe that I'm actually hypertensive. I feel like the doctors lied to me. I measured her blood pressure. It was 210 out of 112.
That's so bad.
The moment you start, you see, when we come to management of these non-communicable diseases, you realize that people who are on and off medication are at a very high risk of getting complications. That even if the cardiac arrest was to come, it would hit more compared to even someone who was never on medication. Of course, someone who has never been on medication stands a high risk of getting the complication faster. But being on and off medication, it's like you're scaling the body. The body has now gotten used to working with, you know, labetalol or aspirin, and then all of a sudden you skip it for another 6 months. And when you try to analyze why people skip medications, partly it's because of the cost. Because restocking these drugs comes at a very high cost. Some of these drugs are not cheap when you go to restock.
Doctor, most of the non-communicable diseases are incurable. Is stroke incurable?
So stroke is a chronic, debilitating disease.
What does that mean?
Once you get stroke, we may not turn back. We can control its effect on the body, but you may never return to complete brain function. Once a part of the brain has died off, it has died off. And we have not yet had brain transplants, at least up to where we've reached with medicine. We've not had these surgeries where I can pick a brain from a donor and, you know, replace with. No, at least there we've not reached there. That means that if someone has already gotten a stroke, the best we can do is to control, you know, give them physiotherapy, have a home caretaker to be with them, help them pick up mpora as, you know, they start writing again. But of course it won't be the language and the normal speech that they had previously.
Yes.
So the best we can do is really to try to bring back a few of the basics, but we cannot bring a complete brain function.
This dives me to the preventive measures as we wind up. What could that be?
So, like the Englishman says, prevention is better than cure. So, if you can avoid getting a stroke, the better. And the first take home when it comes to prevention is lifestyle modification. Last week we preached lifestyle. This week we are preaching lifestyle. Next week we shall preach lifestyle. People, please have time to work out. Exercise, and for us to even say at least 3 times in a week. And when you're exercising, let it be an exercise of at least 30 minutes. Not walking from here up to downstairs and you say, I think I'm done with my day's exercise. Want something that is vigorous, that will allow all body cells to breathe, you know, to burn out these excess fats.
So one of us, Becky, normally walks from studio to the bathroom to the kitchen, and it's like, man, I'm doing great exercise.
No, Becky, if you're watching this, it's not enough.
Yes.
We need you to sweat. We need you to pant. We need you to burn these excess fats out of the body. And then stress management. You know, we have different ways of coping with stress.
Okay.
And stress is part of living. You cannot say that I'm free from stress. No, you're a student, you're a father, you're a worker, you have bosses, you have
somehow
stress will
get through of you.
But find ways of coping up. If you know talking to people helps you, if you know taking time off and you go into the woods and you meditate helps you, find a way of managing stress. Then third and very important, diet. I will not emphasize the importance of managing our diet. When I said diet, last week we talked about the DASH foods, the dietary supplements against stroke and against all these NCDs. Please, let's get used to supplementing our diet with the fruits, the vegetables, you know, the katunkumas, the dodos, alongside eating KFC and fried chicken and, you know, chapati on a daily. If you can, try to regulate. Then very important about prevention, let's go for cardiovascular risk assessment. Let's go for screening. You screen, you get to know how you're standing, it's easy for us to help you. You don't come, you don't know how you're standing, the next thing we hear is a sudden cardiac arrest, is a stroke, and that is something we are preaching as ASAP, that people need to know, they need to be informed so they make informed decisions.
Thank you so much, Dr. Asasida Ignatius from Alliance for Stroke Awareness Prevention Project. We've been discussing what you didn't know about stroke. Now, I think that you know. Knowledge is power. Like you said, what you don't know will kill you. What you know cannot kill you. Now that you know, prevention is better than cure. Is my name. We can't go beyond this. It's been exciting and instructive. See you then tomorrow, same time. God bless you. Bye.